So I would like to introduce Sue Latosha, who is in community outreach at Advocate Aurora Health and has been helping us put on all of these wonderful programs for the Oaklawn community. Thank you so much, Sue.
You are so welcome. And Megan, thank you for inviting us to do this. We love to get health information out to the community. So we are very fortunate to have Sarah Glowacki this evening. She's going to be speaking on stroke. And she did receive her Bachelor of Science in Kinesiology from the University of Illinois at Champaign-Urbana in 2006. And she received her doctorate of physical therapy from Midwestern University in 2009. Sarah has been practicing physical therapy for 12 years at Advocate Christ Medical Center. She's worked with neurologic populations in the inpatient rehabilitation, acute care, and outpatient settings. Sarah is a level 3 therapist who has been active participant of the Stroke Committee for 11 years and is currently the co-chair. Congratulations, Sarah. Through her involvement with the Stroke Committee, Sarah has performed staff training, community presentations, development and presentation at the Advocate Christ Medical Center stroke course in 2011, 2015, and 2018, and worked to create a partnership with the SSEEO, an organization dedicated to providing support to stroke survivors. Sarah is currently the leader for Advocates Rehabilitation Neurology Practice Council. Sarah received her neurologic clinical specialty certification in 2014 and serves as a mentor to staff on treatment techniques for the neurologic population. And she also remains active with the IPTA, previously serving as an assembly representative and the chair for the IMAP program. Sarah, you sound like a very busy person, and I'm sure you have a family life in addition to that. So thank you for your time today and your expertise.
Well, thank you, Sue, for that lovely introduction. So like she said, my name is Sarah Glowacki. Before we start the presentation today, I would like to do the poll that Megan has for us. So Megan, if you want to throw that up on the screen. If you guys could, yeah, go ahead, and it looks like there's just a couple, I think it's 5 questions, yes. So if you could just take a moment to answer these 5 questions. If we don't care if you get all of them wrong, we just kind of want to know what you know. And then take a moment to remember these questions because there may be a post test. So I'm just going to pause here for a moment to give you an opportunity to complete the questions. All right, Megan, we looking good? Another minute?
Maybe another 30 seconds in case people need a little time. If you're not able to do it, that's okay too. I know sometimes it's tricky to like do poll questions in a virtual environment, but looks like a couple people were able to at least. So we'll give it another few seconds and then be good.
Okay.
All right. Yeah, I think we've got everyone. Okay.
All right.
In the polling.
So,
and I share the results.
Yeah, go ahead. Let's share the results. All right. Cool. So this is kind of where we're starting at. So AFib is the leading cause of stroke. True or false? At the first sign of, so everyone thinks that's true. At the first sign of a stroke, what is the most important thing you should do? And it is, you are correct, it is to call 911. What can a person do to help prevent a stroke? Correct. All of the above. Be fast. You guys are awesome. You got that one correct, 100%. And 80% of strokes are preventable. 100% got it correct. So we'll go through the presentation. And if you guys have questions, go ahead and put them in the chat function, and Megan will make sure we go over them at the end. So I am going to do my best here to share my screen. All right, there we go, start. All right, are you guys seeing the presentation? Perfect. And Megan, if at any time you guys don't hear me or whatever, feel free to stop me and let me know. All right, so another name for stroke is brain attack. I encourage people to think of a stroke like you would think of a heart attack, something that you need immediate intervention with to get yourself to the hospital. Why should you care about a stroke? There are more than 795,000 Americans that have a stroke every year, which breaks down to about every 40 seconds, someone is experiencing a stroke somewhere in the US. Excuse me, stroke is the leading cause of long-term disability, and it's the 5th leading cause of death in the United States. In 2010, it was an estimated cost in the United States of $73.7 billion. So imagine what that cost is worldwide, and then imagine what that cost has in 11 years has moved up to, because nothing ever gets cheaper, right? So tonight I wanted to go over what is a stroke, who is at risk, are there warning signs, how would a stroke be diagnosed? So if you think you're having a stroke, what would happen, or someone you love? Is there a treatment for stroke, and can stroke be prevented? So let's start with what is a stroke. So a stroke is a sudden interruption in the flow of blood carrying oxygen and nutrients to the brain, killing the brain cells in the immediate area. For every 1 second that a stroke is occurring, 32,000 brain cells die. That is a staggering number, hence the reason that it is so important to get to the hospital or to get intervention as soon as possible. There are 2 different types of stroke. One is called an ischemic stroke, which is going to be the picture on the left side. An ischemic stroke is a blockage in the blood, which interrupts the blood flow to a specific area of the brain. And then the second type is a hemorrhagic stroke. A hemorrhagic stroke is a rupture in a blood vessel that causes bleeding into the brain. The bleeding there'll be blood that bleeds into the brain tissue. 85% of strokes are ischemic and 15% of strokes are hemorrhagic. There are 3 different types of ischemic strokes. The first one is a thrombosis, which is a blockage in a blood vessel within the brain or the neck. The second one is going to be a blood clot that travels from another part of the brain, from another part of the body to the brain, and that's going to be called an embolism. And then the last one is just a severe narrowing of an artery leading to the brain. So this is called stenosis. And so you'll oftentimes hear of stenosis that happens in the neck or in the brain itself. All right, so hemorrhagic stroke is when a blood vessel breaks or ruptures, causing bleeding in the brain. A hemorrhagic stroke is more severe and it is often deadly. And a hemorrhagic stroke will oftentimes be accompanied by a severe headache. So I know a lot of times my patients or community members, when I do this presentation, ask about their friends or family members, and they'll say, well, I had a mini stroke or I had a warning stroke. The technical name for that is a transient ischemic attack. A transient ischemic attack, which is a tongue twister, is abbreviated TIA. And so you'll have stroke-like symptoms that last for a few hours, but by definition, they have to last less than 24 hours. A person who has had a TIA is at 10 times the risk to have an ischemic stroke. The highest risk is going to be within the first 3 months after their TIA. And 35% of patients that have a TIA will have a stroke within the next 3 to 5 years after their TIA. So it truly is a warning stroke. And if you do experience one, a lot of patients don't realize they've had it because that they have experienced one because the symptoms resolve. But I strongly encourage you to reach out to your physician and talk to them about that. And write down what your symptoms were so that you can remember them for your doctor. But ultimately, what you'll learn today is if you start to experience symptoms, you should be calling 911. So who is at risk? So everyone is at risk. Babies in their mother's belly can have a stroke, elderly can have a stroke, and every single person in between. So the one thing I wanted to talk about is non-modifiable risk factors, right? So these are things that we can't change. We can't change the fact that we're getting older. When you hit the age of 65, your risk for a stroke doubles. Gender, we can't change our gender. So men are more at risk for stroke than women, but women are more likely to die from a stroke. Ethnicity, I know African American and Hispanics are more at risk for stroke. Family history of a stroke. So if someone in your immediate family or someone close to in your family tree, close to you in your family tree has had a stroke, it places you at a higher risk for stroke. Heart disease. So if you have heart failure, heart defects, or coronary artery disease, you are at a higher risk for having a stroke. And then if you've had a previous stroke or you've had a TIA, you're at a 25 to 40% greater risk of having another stroke in the next 5 years. So these are things that can't be changed. But the good news is there are a lot of modifiable risk factors. So these are lifestyle habits that can be changed that can help to prevent a stroke. And this is where I encourage my patients to focus and collaborate with their doctor. So high blood pressure, also called hypertension, it is oftentimes called a silent killer because many people will have it without knowing it. It makes it harder for the heart. It causes the heart to have to pump harder in order to move blood throughout the body. And when left untreated, high blood pressure is one of the most common causes for a stroke. High cholesterol. So high cholesterol is a condition where there's fatty deposits left within the arteries of your body, preventing blood flow to the brain. So this would be a good cause, like a ischemic stroke that would be caused most likely. AFib or atrial fibrillation, a lot of people will call it AFib. It's an irregular heartbeat. So it's what happens when the upper chambers of the heart aren't pumping effectively and they're quivering. So this can cause blood to pool in the upper chambers of the heart and can allow a clot to form, which can then be carried into the brain. Diabetes. Diabetes is an independent risk factor that causes blood vessels to become fragile. Many people with diabetes also have high blood pressure, high cholesterol, and are overweight. Tobacco smoke. So tobacco smoke damages blood vessel walls with the buildup of nicotine and carbon monoxide. So one of the most important things you can do for yourself is to quit smoking. Physical inactivity and obesity, which puts a strain on our entire circulatory system, and alcohol and drugs has been linked to blood clots, heart complications, and stroke, especially in the young population. All right. So the stroke risk scorecard. I encourage everyone to go to the National Stroke Association's website and take their quiz so you can get your score. If you fall within that red category, you fall as a high risk. And so I believe if you have 3 or more of those items within the red category, you're considered high risk. And I strongly encourage you to talk to your physician to talk, what are the things you can do to decrease your scorecard? So is it to, manage your blood pressure, to decrease your cholesterol levels, to manage your diabetes, to quit smoking, and the list, to lose weight, to become more active. So highly encourage you to do so. If you're in the yellow category, you're doing great. Keep working towards that green category. And I still encourage you, to talk to your physician to make sure that you are addressing any of the caution areas that you might have, because the best thing you can do is to decrease your risk is to manage those items. And then if you're in the green category, great job, you're doing awesome, keep it up. All right, so are there warning signs? How do you know if you're having a stroke? So signs and symptoms, and there's lots of these. So one of the big ones is going to be dizziness or difficulty walking, feeling off balance. A lot of times you'll hear people say, one side of my body went numb, one side of my body got weak, one side of my body stopped working, blurred or double vision, and then confusion and trouble speaking. So these are probably the big ones that I'll hear about the most. But I encourage everyone to learn the mnemonic FAST. So FAST. F stands for face. Ask the person to smile. Does their smile appear even, or is one side of their face drooping? Arm. So ask your patient or your family member to release their arms up. If they lift their arms up and one arm drifts down, that's a sign that they could be having a stroke. S stands for speech. Is their speech garbled? Are they unable to get the words out? Ask them to repeat something you said to them. My name is Sarah. Can they say that? And T stands for time. So if they're showing even just one of these signs, I would call 911. The most important thing you can do is call 911, and we'll talk about that a little bit later. So there's a new mnemonic coming out now called Be Fast. So Be Fast includes obviously the BE, B standing for balance, and E standing for eyes. So if someone's complaining of blurred vision, double vision, loss of vision, I've seen, but any sudden changes in their vision should be a concern to you and to them. So you want to make sure that you recognize that. So the reason they're adding the B is because that addresses the BE are more signs and symptoms you'll see from a stroke that might be coming from the back of the brain, versus the FAST are more signs and symptoms of a stroke that you'll see in the front of the brain. What are the effects of a stroke? So a stroke is going to affect the part of the brain where it is located. So our brain controls everything in our entire body. If you have a stroke in the back of your brain, you might have more visual deficits, versus in the front of the brain, you might have some more what we call executive functioning deficits, or like impulsivity, poor judgment, and then anywhere in between. And so we'll talk a little bit about that. So effects of left versus right brain strokes. You're going to have left brain deficits that are going to include things like your language, so both written and spoken. If you have a stroke on the left side of your brain, it's going to affect the right side of your body. So you might have motor deficits on the right arm or leg. You're going to have difficulties with numbers, with reasoning, and oftentimes you might see memory deficits. On the right side of the brain, you're going to see deficits on the left side of the body. You're going to see some deficits into insight. Oftentimes you'll see deficits with memory. And then you're going to have some visual spatial deficits. So like 3D forms is a good way of putting that. Or like when you walk into a room, you might have a hard time clearing the doorway because you might bump into that door frame because you have a hard time telling that perspective. How is a stroke diagnosed? So the first thing that the doctor or the nurse or whoever the healthcare professional is going to do, the EMT that comes to your home, is going to do a neurological examination. So they're going to look at your muscle strength, your ability to move. They're going to assess your speech and language. They're going to assess your vision, your memory, and then your overall behavior. Once you arrive at a hospital, they're going to use diagnostic testing. So a CT scan or a CAT scan, which stands for computerized axial tomography, or an MRI or MRA. So they're looking at your blood vessels, and they're looking, these special tests will look inside your body, and they help you to find they help the doctors to find the location of the diseased, narrowed, enlarged, or blocked artery. And then for other diagnostic tests they might use are going to be an echocardiogram or a carotid Doppler. Both of these tests are ultrasound, and they will look at the echocardiogram looks at the heart. The carotid Doppler will look at the blood vessels in your neck, which is the carotid artery, carotid Doppler, sorry, is used less frequently now due to the fact that the MRI and the CT scan is available. The ultrasounds are quick and painless, and they use sound waves to look at the arteries surrounding the heart and the neck. And they're quick. So if they think you're having a stroke, what is the treatment? So first line of defense is going to be blood thinners. So antithrombotics or anticoagulation. I know some people will take aspirin at home as a preventative blood thinner. I highly encourage you to speak with your physician before beginning aspirin, despite the fact that it is an over-the-counter medication. And then you can see that there's several blood thinners that are listed there: aspirin, Plavix, heparin, Lovenox, Coumadin. So those are all types of blood thinners that might be administered. And then the second one there, the tissue plasminogen activase or TPA, is a clot buster, and it has a narrow window of when it can be used. Right now, I believe it's FDA approved for 3 hours post your first symptom. So as soon as you think you're having a stroke or someone that you love is having a stroke, you have that 3-hour window to get this medication to them, which can help to actually bust up that clot that's in the brain. Beyond that time window, it does carry a risk of hemorrhage. So they're very strict. There are some studies right now that are assessing if TPA is safe to use up to 4.5 hours, so giving that hour and a half more. But I don't believe the studies have been concluded yet, and so I don't believe the FDA has approved it for the 4.5 hours in all cases. I think in some limited cases, maybe. So if you or someone you love, you think is having a stroke, that T in time to call 911 is very, very important to get them to the hospital as soon as possible. Because the people that do receive TPA do tend to have reduced severity of their symptoms in the long run, reduced disability. There are some procedures that can be done in the event that there is a clot. So just like when someone's having a heart attack, there's angioplasties and stents. These can both be used in the brain as well. The third one listed here is going to be the carotid endarterectomy. So a carotid endarterectomy is these vessels in your neck where they will remove the plaque that's in there that's causing the stenosis, allowing blood to flow more freely. So some examples here of other interventions are going to be basically thrombectomies. So what that means is they can go into the blood vessel and they can actually remove the blood clot. So I believe most of these start in the thigh, and they actually feed the wire up to the brain. And so they can use this to then remove the blood clot that is in the brain and allow blood flow back to that part of the brain. So the Mercy retriever, which is oftentimes referred to a corkscrew, so you can envision that like you would a wine bottle, where you twist it into the clot and then you pull it out. There's coiling. So what this is they're filling the blood clot with a little metal coil, essentially allowing it to open. The penumbra system is a vacuum that sucks it out. And then the solitaire and the Trevo are, my understanding is they're both clot retrievers, where they kind of pull the clot out as well. And they're a little bit newer to the market. Can a stroke be prevented? So you guys all got this question right. 80% of all strokes can be prevented, which is great news. But it's going to take more people like you coming to these presentations to learn how to prevent them. So The most important thing you can do is educate yourself. So you guys are doing awesome. You're here tonight. I want you to take 1 or 2 or 10 facts and spread them amongst the people you love to help them and encourage them to know their stroke score and to know that they can prevent a stroke. Because the best time to learn about a stroke is before you have one. Because remember, once you have a stroke, you're at a higher risk to have another one. So what you can do, so know your signs and symptoms, know your risk factors, know your numbers, improve your diet and see your doctor, and most importantly, stop smoking. So what are the signs and symptoms? Remember your fast, right? So remember your be fast and your fast. Make sure that you remember these so you can get appropriate care when you need it. Know your risk factors. So go to the National Stroke Association and take their pre-quiz and know your risk factors. This includes your numbers. Know your numbers. What is your blood pressure? Who here can say, I know my blood pressure or what it is on average? What's your cholesterol? What's your blood sugar? Know your weight. Be able to just have these discussions with your physician. Improve your diet and exercise. So make sure you're eating a heart healthy diet is a brain healthy diet. Make sure you're getting 5 or more servings of fruits and vegetables a day. And then try to get about 30 minutes of exercise 5 to 6 days a week. So making sure that even if it's just out walking, making sure that you're doing some type of physical activity. See your doctor and know your doctor. So make sure you're taking your medications as they're prescribed so that you can manage your individual risk factors. And then obviously stop smoking and don't start. Be stroke smart. So reduce your stroke risk, recognize stroke symptoms, and respond at the first sign of a stroke. Call 911 or get to the hospital fast. All right, so remembering your FAST or your Be Fast. And then here are some wonderful resources. I can leave this up for people who want to look at it that have stroke information. They talk about knowing your stroke score. So I encourage you guys to look at them, but I highly encourage you to go to the National Stroke Association's website. All right, so any questions?
We did have one come in the chat, Sarah. Somebody is asking, can you explain what makes Christ a comprehensive stroke center?
Absolutely. So there's 2 designations for stroke centers. One is just a stroke center, and then one is comprehensive stroke center. So to be a stroke center, you have to be able to administer TPA within that 3-hour window. You have to have, I believe, when someone comes in with stroke symptoms, there's an amount of time that has to be met to have that patient evaluated and then to receive the care they need. And then there's multiple other things beyond the ER that make it a stroke center, including like the training of the staff, from nursing to phlebotomy to doctors to therapists. To make it a comprehensive stroke center is we have all of the specialties on site 24 hours a day, 365 days a year. So if you were to need someone who, we call them a neurointerventionalist. So that is a specific type of doctor that does the thrombectomies. So they can do the brain surgery, and they are available 24/7 all the time. And I think that would be the big difference between a stroke center and a comprehensive stroke center. It's just the amount of specialties that are available. Does that answer your question?
I hope so. I think it answered their question. So for preventing strokes too, like if somebody's had a stroke already, is it the same type of prevention as if you haven't had a stroke? Like, should those still be the same things that are followed?
Yes, 100%. You still want to make sure that you know your numbers, that you're managing your blood pressure, that you aren't smoking. It's the same prevention as if you haven't had a stroke. Your stroke risk is just automatically going to be higher because you've already had one.
Gotcha. Does anyone else have any questions for Sarah? You can feel free to unmute if you want to, or put them in the chat and I'm happy to answer them too.
Hi, my name is DeAndre. I'm one of Susan Latocha's interns. I have the question of how can you tell the signs before a stroke happens? Like in person, do you see like a certain physical sign?
So unfortunately, it's not a sign before the stroke happens, but as the stroke is happening. So you'll start to see those FAST signs. You're gonna, you might start to see their face droop. You might start to see their arm get weaker. You might start to have garbled speech. They might be off balance. They might complain of, wow, my eyes just got really blurry and I can't clear them. So it's very important to know those signs of, I know in the presentation, it's labeled, I guess, as a warning sign, but it's really the sign of a stroke. And so if you're seeing those, I wouldn't wait. I would call 911 immediately, because the worst thing that happens is the EMTs come out, they do their evaluation, and it's determined that the patient or the person doesn't need another level of care. And so they leave, or it's like, hey, we really should get you some care. And so they end up taking them to the ER. But either way, I think you're going to feel better knowing you've got someone medical to come and evaluate that person.
Hi, my name is Janet Ajayi. I work with Susanna Tosha. So I have a question. I heard about this medicine that they give at the hospital and you need to know the time. So is that like a time frame or something?
Are you asking about the TPA?
Yes, I think that's what it's called.
Yeah, so the
Okay, so-
time frame that it's currently FDA approved for is 3 hours. I know they're working on FDA approval for 4.5. So if you or someone you know, or if you or someone you love, you suspect them that they're having a stroke, the first thing the EMTs are going to ask is, when were they last normal? So when did the symptoms start? Because if you don't know, or it's an undetermined, like if they're not able to determine that time frame, that automatically disqualifies them for TPA.
Okay, thank you.
You're welcome.
Anyone else? Sarah, did you want me to put up the poll again?
Yes, I was going to say, if we're ready, let's put that poll back up.
There we go. Maybe a couple, like 30 more seconds, maybe. There's a couple people, I think, maybe. I haven't quite finished. All right, perfect. All right, I'm gonna go ahead and end the poll and I'll share the results too.
All right. Perfect. So AFib is the leading cause of stroke. The answer would be true, correct? So atrial fibrillation is that irregular heartbeat that we talked about, where the top chambers in the heart quiver and they don't beat effectively, causing blood to pool there, which can lead to a blood clot, which can then travel up to the brain. So that is true. Atrial fibrillation is one of the leading causes of stroke in the United States. At the first sign of a stroke, what is the most important thing you need to do? Correct, note the time. So remember, that's going to be what the EMTs want to know. When did these symptoms begin? So note that time and call 911. Okay. What can a person do to help prevent a stroke? So correct all of the above. Don't smoke, maintain a healthy weight, and maintain your blood pressure at that 120/80 or less. What does B fast stand for? Way to go, 100%. So remember, are they off balance? So B is for balance. Are they off balance? Are they walking a little funny? Are they losing their balance? Number E is for eyes. So are they complaining of a sudden change in their vision? Blurred vision, double vision. F is for face. So we're looking at their smile. Is their smile even or is one side droopy? A is for arms. So if you ask them to lift their arms, can they get both arms up over their head? Does one arm tend to drift? And then speech, you're looking at their speech. Is it garbled? Can they repeat a simple phrase? And then T stands for time to call 911. And then the last question, number 5, 80% of strokes are preventable. This is true. So it's amazing that 80% of strokes are preventable. So know your numbers, talk to your doctor, and take care of yourself.
Excellent. Any last questions for Sarah before we go? I'm going to go ahead and stop the recording.